This COVID-19 prevention tip is important because many go-to sources do not mention wearing gloves to better prevent getting infected with COVID-19, even though wearing gloves work. These go-to sources I have checked include World Health Organization website and videos, Center for Disease Control website and videos, Wikipedia page on COVID-19, numerous COVID-19 prevention videos online. They do not even mention that cash can contain and spread COVID-19. And the pictures we have seen online show lots of masks, but very few gloves. I did test out that the constant wearing of gloves may be as important as washing hands. Many reports still mention an unexplained gap globally between all known or public COVID-19 preventive measures and the still rapid spread of the COVID-19 virus. That more can be done to mitigate the spread of COVID-19. Glove wearing may be the answer. The benefits are threefold. Use benefit 1. Most know that COVID-19 spreads on contact with infected surfaces. Mention is made elsewhere of limiting hand-to-hand contact, such as handshakes and social spacing, but COVID-19 is still spreading because it can be on any surface. We cannot go outdoors and buy stuff without coming into contact with surfaces or touching items, such as opening doors to restaurants, cafes, banks, offices, pharmacies, hospitals, restrooms, subway turnstiles, and touching coffee cups, grocery, pharmaceutical, office items, etc. The COVID-19 virus can be on a surface or item for hours before your bare hands touch that surface or item. In wearing gloves outdoors constantly, as you go about your day-to-day, you are putting up a minute-by-minute barrier or second-by-second barrier to COVID-19 getting onto your bare hands. Use benefit 2. We are told to minimize, even stop our hands touching our eyes, nose and mouth, and we do this often, daily. It is hard to stop. Anyone having to wear gloves constantly, such as for winter cold, knows how restrictive wearing gloves can be. Using phones, keyboards, pens, cutlery, eating, etc. are all difficult if you are wearing gloves. And this is a good thing to prevent getting infected with the coronavirus. When wearing gloves, we do not touch our eyes, nose or mouth with the gloves. These adjustments do happen almost automatically. We hesitate and either use our sleeves or take off the gloves. Any hesitation with hand usage is good to prevent getting infected with COVID-19, and wearing gloves becomes like an assistant constantly looking over you and reminding you, do not touch your eyes, nose or mouth with infected hands. These few seconds to remove gloves to wipe our mouths also allow us the time to grab a tissue after a glove is removed and use the tissue on our face instead. Use benefit 3. Cash is a surface that can contain and spread COVID-19. Cash transactions might be the hidden source of the COVID-19 spreading rapidly in some locations. With gloves, handling cash infected with COVID-19 is now greatly reduced. These are the 3 benefits. To the media, because people heed what you say, to the experts, and to others that may not be convinced that wearing gloves almost non-stop outdoors will prevent you getting infected with COVID-19. Perhaps you can go to a store or mall and touch all the surfaces, items, and cash you can now legally touch, with your bare hands. Then touch your nose and mouth after. If you don't want to do this, it is because you may get infected. There is your proof that gloves will work. At least try gloves. The cost is minimal. Try it for a day. I am asking for the media to ask the experts about glove wearing. Kindly share this video with your media contacts. These are the gloves I now wear outdoors constantly. Waterproof on palm side, knitted on back of palm. Fit snugly, and I prefer the durability and thickness to thinner ones. Latex and nitrile gloves are also effective, but will not last as long. Do you plan to continue touching contaminated surfaces with your bare hands? Do you plan to continue touching your face with your COVID-19 contaminated bare hands? Do you plan to continue handling COVID-19 contaminated cash with your bare hands? With the vaccine so many months away, to prevent yourself becoming infected with COVID-19 requires adopting minute-by-minute best practices to your daily life. This is a marathon, not a sprint. Remember, adopt minute-by-minute best practices. Please adopt the constant wearing of gloves outdoors, because what works here will work elsewhere for all. Please share globally, everyone, everywhere.